This is a short video to show you how to do ultrasound-guided cystocentesis or ultrasound-guided fine needle aspirates. It's basically the same technique for both, but it's good to practice on something. So what I have here is a jelly phantom with some water balloons inside them to represent bladders. So when we want to do our ultrasound-guided procedures, we need to make sure that we have cleaned all gel off, and that's because the gel causes terrible artifacts if it's a fine needle aspirate. It's also not sterile as well, so we don't want that getting in our samples. So remember, we need to use spirit to have a good contact, and in that case you want to protect your probe from the effect of the spirit. In this case, because it's a phantom, I'm just going to leave the gel there. It just makes it a bit easier. So when we come to do our ultrasound guided procedure, we need to use both hands. And if you're anything like me, you're going to have a dominant hand, and I'm very right hand dominant, but you need both hands to do things. So normally we would scan with our dominant hand, so in my case, the right hand on the probe and the left hand on the machine, fiddling with knobs, so basically playing the piano. But when we come to do an ultrasound-guided cystocentesis, we need to decide which hand is going to be holding the probe and which hand is going to be doing the sampling. So I find it easier if I do the main bit of the scan with my hand, with the probe in the right hand, and then when I found a nice clear window of where I want to go in, I keep the probe still and I swap to holding it in my left hand. Now my left hand is capable of moving it around a little bit, but it's a bit clumsy feeling, so I basically just hold it still. Then you want to get your needle and syringe, and you want to insert it. Now make sure that your hands are stable, so put your hands on the animal, tuck your elbows into your body so your hands are doing as little movement as possible. You're going to insert your needle at 45 degrees to the skin, roughly, and just a few millimeters away from the probe so you don't injure the probe by any means. Okay, now I'm going the opposite side to where the marker is on the probe and the marker is on the screen, so I know it's going to come in from the right hand side there. So parallel to the probe, and just carefully insert it a little bit. Now if you don't see it, it's because you're not directly in line with the needle, and you need to move the probe a little bit, fan it around. See, there we go, you can see it there. Okay, so we can now see our needle and we're safe to proceed there. And there we go, the needle is now in. We almost lost it there, so we've come back and you can see the very bright tip of the needle there, and that's because that's the bevel there, and that's very reflective. And then we can do our aspirate. Okay, so make sure you can see the needle at all times, especially the tip of the needle, and just suck it a little bit, release the suction, and then withdraw slowly out the way you came. And that's how you take an ultrasound guided cystocentesis.